Hi, welcome back to my channel. My name is Aminata. I am a nurse practitioner, and on my last video, I talked about what are some things that you to expect. What is it like to meet with a mental health provider for the first time? So that way, some of you guys that are a little bit anxious and worrying about wanting to go see someone for your mental health, but you don't know what to expect, kind of give you a picture of what to expect. And in this video, I wanted to talk about what to expect after you've meet with your provider the first time. So this will be for your follow-up appointment. So usually by the first appointment, things either really go great, which most of the time with me, things go really well. Most of the time, okay? And then usually, so I meet with you and we talk about different things such as about your overall health, family history, medications that you take, surgeries, and we start you on a medication or increase the medicine that you're already taking. So we come up with a diagnosis, whether it's a new one or if you've already had a previous diagnosis of whatever the mental illness is, and we start you on a medication, or we increase the medication that you're already taking, or stop that medicine, whatever the plan is. So today we're going to assume that we started you on a new medicine. Okay, for example, we started you on a new antidepressant. So I'm following up with you about 2 weeks later to figure out what's going on. So usually what I do is, again, just ask patient, how have things been going since I last saw them? And do they have any concerns today? That's a term that I use a lot about when I'm seeing someone, whether it's especially for follow-up visits, is do you have any concerns today about your health or about your medications that you want us to start off with? And then if they said no or yes, and then we talk about the concern first. And then if they said no, then I usually go about starting off with medication. So I review each patient's the medications that they're on, even the ones that I'm not prescribing, to make sure that they're still on those medications. So that's pretty much what they call medication reconciliation. So you go over a list of all the medications that they take, and then for the ones that I prescribe, I go over those as well. And then if I started on a new medicine, I usually ask, so we started you on this medicine, how did things go? Did you tolerate medication okay or not? And then if they don't tolerate it, I usually would put notes on what are the things that happen, what side effects did they get from it, so that way if we decide to keep that medicine the next time, I know that they were having these issues before, and now they that those issues are gone, or they continue to be a problem, or they stay the same. So I usually will ask about side effects, and then I'll go on to ask systems such as any stomach issues. So some of the common side effects of the medicine, sometimes even if the patient don't tell me, I will ask about them, because that's something that I want to know, that they're not having these issues. Because sometimes people forget, honestly, because maybe they experienced it in the beginning and then the symptoms fade away and then didn't have problems anymore. Sometimes people just overlook some side effects and things like that. And then the next thing that I go about is go through the diagnosis and try to figure out how have things been going. So if it's anxiety first, I start with that. How have your anxiety been since I last saw you? Do you feel as though, what aspect of it is better? What aspect of it is worse? Or things the same? So depending on what's going on, usually if things are the same and you're tolerating your medication, and you feel as though things are still a problem, that the symptoms you're experiencing are still a problem, then we'll discuss about, okay, let's go up on your dose a little bit, especially if you're tolerating the medication. And then if you say things are better overall and things are manageable, I usually say, well, let's hang tight where we're at, and then let's reassess again, depending on what the patient feels comfortable and depending on the medicine that we're taking. So sometimes we do in 2 weeks, in 3 weeks, in a month, in 1 week. So it just depends on different factors. And usually if the patient, things are way out of control or they're not tolerating the medication, we usually talk about switching it to a different medicine. And again, I always make sure I go over with my patient, do they have any concerns about the medication that they're taking currently? In terms of follow-up visit, what to expect, a lot of the times it's usually just checking over and seeing how things have been going since you started the medication, or since you started the medication and therapy, or whatever plan that you guys put in place, to make sure that that plan, that medication or the plan is working for the patient, and making sure that they're not having any issues, and then evaluating and see if that's something that they want to continue with that plan. Sometimes there's a little bit more that goes on in terms of maybe patients end up coming up with new diagnosis because of different situations, and then the visit might go a little bit longer. And a lot of the times for follow-up visit, depending on where you work, it takes about 30 minutes whereas an initial visit usually may take about an hour. You do have some places where they do initial evaluation or initial visits about 45 minutes or 40 minutes. It just depends on where you work. For where I work, for an initial evaluation is usually, if it's your first time meeting me, we take about an hour visiting. And then if it's, sometimes it may go over an hour, to be honest with you. There's times where it took more than an hour. Even the follow-up visits was supposed to be about 30 minutes. And sometimes it may take longer than that. It just depends on the person, and you kind of work with your patients as things go on, and sometimes you have no idea of how the visit is gonna go. One other thing that I wanted to mention was that every time I'm seeing a patient about their mental health, I always ask about suicidal thoughts with the plan. And I always make sure if someone has a suicidal thoughts with the plan, we have a safety plan in place. That's something that's very, very, very important when you're meeting with someone, whether they have previous a history of suicidal thoughts with planning or attempt. Regardless of it, I always ask about those, because that's something that's very, very important. If they tell me they have a suicidal thoughts, I usually ask what it is specifically. What kind of thoughts do you have? For example, people have a lot of passive thoughts, such as, I wish I wasn't alive, I just want this to end, I want to go to bed and not wake up. Usually I'll ask follow-up questions like, when you have those thoughts, does something usually come in mind as to, if I want to go to bed and not wake up, what would I do to make sure that happens? So that's a plan. And you want to make sure you assess that. And then if they have a thoughts and a plan and intention. So usually a lot of the times I focus more on the thoughts and the plan, because a lot of the time patients who say, well, I have no intentions of doing it because of my loved ones, because of this, because of that. So usually I focus on the thoughts and the plan, and especially if they have means to carrying those plans, especially if they said, I'm going to take my medications, for example, and so to make sure I don't wake up. So you have access to your medications. So I always make sure we have a safety plan, whether you call 911, go to the ER, call the suicide line, have someone that you can call whenever you have those thoughts and plans, so that way they can keep you safe if it's your medications you're thinking about, so that way they make sure you don't have access to your medications, whatever the means is, so that way they can keep you safe. And if that person, or you don't have anyone that can keep you safe, or you can't keep yourself safe, you want to make sure you go to at that point you need a high level of care, whether it's in the ER where they monitor you, or an inpatient. So that's something that I kind of wanted to mention also. That's very important when you are meeting someone for the first time, and also when you're following up. Always make sure you assess with suicidal thoughts with plan, and come up with a plan just in case when they have those thoughts and plans, for people that do. And that's pretty much it for this video. Until next time, take care, guys. Stay positive, be kind to one another, and don't forget to check out the other video that talks about what to expect during an initial visit with the provider. And I'll see you guys in my next video. Take care and happy holidays. Bye.